Okie dokie. So yeah, we'll start on this one here. And actually, let me go back one just to make sure. So we did go through this part though?
No.
Hold on. What about this one?
I don't think so, no.
I know we did that one.
Yeah, I think
We
we
did
were
blood
like
tests,
right there.
right?
Yeah.
Did
Yeah,
we do
I think
this
so.
one?
No, we didn't do this one.
Okay, gotcha. So so basically, where we left off before, what we had gone over was the different chambers of the heart, right? And then we went through the difference between like arteries and the vessels and veins and all that, and the layout, the structure, the anatomy, I should say, of all that. Correct?
Yes.
Okay, gotcha. Okay, so unborn children are getting their oxygen and nutrients from the mother's blood. So while they're in the womb, basically the mother's blood is circulating through the baby. So that's kind of why too, if there is a mother who has a bloodborne pathogen, almost always, actually I should say I don't know, it's highly unlikely that they wouldn't get whatever bloodborne pathogen they have because they are receiving blood from their mother. They're not necessarily creating their own blood yet. But as they grow and mature, they will start to, well, once they're born, they do create their own, or they are basically developing their own blood cells and everything at that point. But as a child grows and everything, their heart rate and blood pressure will increase. So, or actually, heart rate is usually higher when they're younger, but blood pressure is pretty low. And then as they age, their heart rate decreases, but their blood pressure rises. So that's why, too, it's usually the elderly patients who are like about 65 or older are more likely to have high blood pressure. But of course, there's other factors to that as well. So, okay. So two kinds of cardiac cells. So we have the electrical or conductive system cells or the myocardial cells. So an electrical cells are the ones that electrical impulse that helps to with the contractions of the heart. Let's see it. Oh no, we still have to. Okay. Sorry, it sounded like someone either entered or left the room, so I wanted to make sure you were still here. So, okay, so the electrical cells have three unique characteristics, which I need to open up my notes here. Okay, so yeah, the cardiac muscle fibers are electrically linked, forming one unit. A myocardial cell forms a strong electrical connection to the next cells through special junctions called intercalated discs. So yeah, the electrical cells is basically what triggers the heartbeat. So this is what they're talking about here, is that the electrical impulse, and then it goes into the different nodes here. So you have your SA node, which is basically where the impulse starts. And then you have your AV node, which is where it then will go into like from the top into the bottom parts of the heart. So so it basically goes through the SA node, the AV node, and then goes into what they call the bundle of His, which is right here that connects from the upper chambers to the lower chambers. So that way it can contract, basically. So yeah, the top parts are pushing blood down into this chamber, the lower chamber, the ventricles, and then pumping into the pulmonary artery, and then it back into the left ventricle and then pumped out into from the left atrium. So the cardiac cells, so the state of the conduction is polarized as like a waiting stage, which is basically in between heartbeats. So you have the depolarization, which is when the impulse hits the cells and basically there's the contraction. And then repolarization is when the heart muscle relaxes, so that way more blood flow can come in. So okay, are you still with us, Tahina?
Yeah, I am.
Okay, gotcha. I just wanted to make sure it was showing something weird. Okay, so conductive system of blood flow. So again, so we have that electrical system that is what makes that impulse for our heart to contract. So when we can perform an EKG, which basically tracks those electrical impulses. So we'll learn more about EKGs through this module as well. But basically, an EKG is checking the electrical impulses, but it can't tell us the structure of the heart. So that would be a different test that we'll go over. But it'll show us there, you know, if there is any issues with the SA node or AV node or a bundle of PIDs, it'll tell us if there's any issues with the electrical impulses and contractions. So. And of course, the cardiac muscle too is different than any other muscle in our body because it changes depending on our activity. So if we are doing, you know, if we're going for a run or something, it'll be harder, so it's contracting more frequently. But our other muscles, of course, don't really do that. So, okay, so blood pressure. So when we're measuring someone's blood pressure, what we are measuring is the amount of force of blood being pushed through the body against the walls of the arteries and veins and blood vessels. So the top number, the systolic number, is measured when the heart is contracting and pumping out the blood. And then the diastolic, or that bottom number, is when it relaxes. So you can see at this little image here, so when it's not contracted, it is not, there's not much pressure on the arteries and the blood vessels, but then when the heart does contract, pushing the blood through the vessels, that is that top number. So like the highest amount of pressure and then the lowest amount of pressure on the blood vessels. And of course, with blood pressure too, I think we did go over vitals before you left. I can't remember for sure if we did go over vital signs or not before you left.
We did.
We did. Okay, gotcha. Yeah, because of course, you know, if you have too much blood pressure on the arteries, the veins, and all of that, you have more of risk of like an aneurysm, heart attack, stroke, any of that, because it's going to be weakening the blood vessels. Because if you think of like the walls of the arteries, the veins, blood vessels, all of that stuff, if you kind of think of it as a rubber band. So, and over time, that rubber band starts to kind of get loose and not really have that amount of resistance anymore. So it's weakened. So. All right, so some factors that could influence blood pressure are blood volume. So if someone has a disorder where they create more red blood cells, that can affect their blood pressure. The strength of the ventricular contractions, so sometimes when that electrical impulse is much stronger than what it should be. And then resistance to blood flow, so plaque buildup, like from high cholesterol and also smoking. Anything that can basically constrict or block the flow of the blood is going to cause a resistance of the blood flow and then cause higher blood pressure. So, okay, so coagulation and hemostasis. So the damaged blood cells will constrict to slow and flow blood through the vessels. So coagulation, the fibrin is in the red blood cells and form thrombus, which is what helps to coagulate or clot something. So if you were to get a scrape or any type of injury like that, the thrombus is basically from the red blood cells that creates that starts clotting the blood so you don't just continuously keep bleeding. So the platelets also stick together when you have like an injury as well. So it's the platelets and the thrombus that go together to help create like the blood clotting. So, yeah. All right, so some different cardiovascular disorders here. So angina is basically just chest pain. Sometimes that can just be acute, meaning it's not, they're not having like a heart attack or anything. It could be, chest pain could be due to a multitude of reasons, but chest pain in general is referred to as angina. Bradycardia is when their heart rate is below 60, and tachycardia is when their heart rate's above 100. The thing to consider with tachycardia, though, is if the patient had been resting or if they just came in from a run, because if they just came in from some activity they were doing and their blood pressure is over 100, it could just be because, you know, as you are doing different activities, your heart starts to beat faster, so that way it can give the body oxygen and nutrients it needs before it's depleted in those areas. So if you have a patient that maybe did just come right into the office and it's above 100, I usually give them about 5 minutes and then recheck it. So, so palpitations as well, which is like that feeling of like a really rapid heart rate and sometimes a skipped beat. Cyanosis is basically a blue coloring to the skin, which happens when the blood is not fully oxygenated, or maybe there is certain blockages where the oxygenated blood cannot get to. So they are losing circulation in those areas. So dyspnea is basically another word for shortness of breath. And then edema is something that happens, swelling usually in the lower legs that could be due to a heart disease. So basically, it's a buildup of different fluids and nutrients that your blood isn't able to circulate out. So it's kind of like a buildup of that. So some other disorders that you could have related to your heart would be arrhythmias, so an abnormal heartbeat. Palpitations are usually ones that are just acute, so they happen, they're not consistent, but arrhythmias are ones that are consistent. Then you could also have congenital heart defects and then heart failure. So you want to make sure to look at your figure 39.6, 8, 4, and 5 in your book. But any arrhythmia or dysrhythmia means that the heart rate or rhythm is abnormal. So it could either be really fast or really slow, or skipping certain beats or uneven heartbeats. Sometimes a patient might have some lightheadedness or dizziness, shortness of breath. They might have some angina, but a lot of times when someone has an arrhythmia, they don't even realize it. They usually will just have like this kind of lightheaded feeling. They don't even sometimes have that angina. So, okay. So some other disorders could be a DVT, which is a deep vein thrombosis, which is a fancy way of saying a blood clot, which is basically a blood clot that blocks circulation in a vein. So usually it happens in the legs. So it's basically where the thrombus forms a vein deep in the body, again, usually in the legs, and then creates a blood clot. So blood is not able to flow through there. The thing that's dangerous with that is if that clot does move, it can either go into the brain or to the heart and either cause a stroke or a heart attack. So a symptom of a DVT would be if someone is having pain in their leg, and you also see some swelling there. It could be a DVT. So some other diseases obviously would be high blood pressure, which is hypertension. A myocardial infarction or an MI is what the medical term for a heart attack is. And then shock, varicose veins, usually, again, varicose veins are usually in the legs. Whoops. Let's go on my note. But they're just swollen veins that can be twisted and seen underneath the skin. They are not necessarily dangerous. Just depending, it depends on the patient. For the most part, they're pretty much benign. But if they get too swollen or start causing pain, then they may need to go to like a vascular surgeon and have them removed or something. So, but some risk factors for heart disease, of course, is age, because as we age, that muscle weakens. So you're more likely to develop some type of heart disease or disorder as you get older. Gender and because of different hormones, genetics. So if, say, your mom or dad had a different type of heart disease or disorder, you potentially are at a higher risk for that because it runs in your family. Definitely smoking will be a huge risk factor for heart disease, which up here, actually, this is a picture of a healthy heart, and this is a picture of a person who was a smoker. So you can see in here, like these little areas that are blue, which is the cyanosis. So their heart even is not getting enough oxygen and nutrients from the blood. So you can kind of see, like, basically this one you can tell is dying off. So smoking can cause high blood pressure, heart disease, and again, can cause like different blockages and everything. Some other things that can cause heart disease besides your high blood pressure is high cholesterol, uncontrolled diabetes, lack of exercise, obesity, and stress plays a huge part too in heart disease and disorders, as well as alcohol. But someone who exercises is going to be strengthening that heart muscle. Just kind of like if you were to do certain exercises, say for your arms, and you're strengthening that muscle, you're also strengthening your heart muscle, because as you are doing those activities, your heart rate increases and you're having those contractions more frequently. So you're basically working out your heart, which is good. So, so some other diseases that can happen would be an aneurysm, which is something that happens from a blood clot in the brain. Endocarditis, which is a type of infection in the endometrium of your heart. So, and usually you can treat this here. So Raynaud's syndrome, where basically to your limbs, so your fingers and toes is usually you get Raynaud's syndrome, where you notice like blue coloring. And usually their fingers are kind of stiff and very cold. So, and the colder the weather, the more severe their Raynaud's picks up. So, blood disorders. So so anemia is a type of blood disorder where you're not producing enough red blood cells or hemoglobin. Hemophilia is basically that lack of that clotting factor. So they're not, if they were to have a injury, like a cut or a scrape or something, they don't have that clotting factor to.
I'm sorry to keep you at your.
Mhm.
Oh, sorry,
So
that was
I
my sister talking
filled
to her
in some
teacher.
of the
Oh, gotcha. Okay.
like.
Did
I'm
you have a
sorry.
question though, or
No, my
But
mom
I'm
has
missing some
hemophilia,
other
so
information for it.
I know it's like
what?
my mom has hemophilia, so
So
I'm aware
is
of
there
what
Oh,
that
anything
is.
that I?
oh, good. Okay, so you know what that. Okay,
Yeah.
yeah. And then leukemia, which would be where you have very low white blood cells. So it's cancer that is basically attacking and preventing your white blood cells from being able to do its job and fight off infections. So some testing that can be done for checking for different heart diseases. So again, you have the EKG, which basically checks electrical impulses. You have an angiograph, which is studying the blood vessels to detect any structural defects, so like a blockage. Um, so that way we can prevent like an aneurysm or stroke or heart attack. So these are some different types of ways that they would check that. Cardiac catheterization, which is, are you familiar with like what a catheter is?
Yeah, I remember. I think this was one of the questions on one of the assignments, and I looked that one up, and it looked really cool.
Oh, good. Yeah. Sometimes they have to do the cardiac catheterization, but so Doppler ultrasound is something we can do in the office, which is pretty fun. You have like a little, usually like when you think of an ultrasound, you think of like the picture, but this one is specifically like we're checking for sound. So we're checking the blood flow in the arms and legs through through specific arteries to make sure that there is adequate blood flow coming through those arteries and veins. An echocardiogram is a sonographic test, so basically an ultrasound of the heart. So it uses sound waves to create the picture of the heart structure. So again, that's just an ultrasound of the heart, which is pretty cool to see actually. Um, So different treatments that they would do for different cardiovascular disorders could be depending on what the disorder is. So of course, if they have some type of uh, arrhythmia, then they would prescribe antiarrhythmias. Anticoagulants would be if someone's producing too much of that clotting factor and say they have that DVT or they create a blood clot pretty much anywhere, they'll be on anticoagulants. So it helps to thin out the blood. And that's really closely monitored. And that's what the PT, the pro time is, where you're checking to make sure like the clotting time. So antihypertensives, so things that we would use to help with blood pressure. So which are there's all sorts of different types of blood pressure medications, and I actually did an assignment with some people about the different types of blood pressure medications between the difference of like beta blockers and antagonists and alpha blockers, calcium channel blockers, all of that kind of stuff. So those are all usually related to blood pressure, but you also have ones that help, that are like a diuretic to help get fluid off. And then of course you have like cholesterol lowering medications. So which pretty much any cholesterol medication is going to end in statin. So it'll be like simvastatin, pravastatin, lovastatin, rosuvastatin. So if anything ends in statin that you see on someone's medication list, it's for cholesterol, high cholesterol. So the last thing too, another type of treatment that you can do for people who do have heart arrhythmias is some of them will have a pacemaker put in. So basically the pacemaker is what creates the electrical pulse. So because your heart, when your body is doing the electrical pulse, it's not functioning properly, where this machine helps to make the electrical pulse, basically will make the electrical pulse do what it's, or activate the way that it's supposed to. So it's implanted into their chest. So you'll sometimes see, like, in their left side, just this little area that's kind of raised underneath their skin. And you, every once in a while, usually patients will have to call in to have it checked to make sure battery is still working and everything. And I'm not sure how this works, but they just hold their phone up to it and then it reads off information to the other side, which is kind of cool. So it tells them that basically the device is working properly, or battery's not, maybe is low or something. So, yeah. Any questions on this chapter so far, Tabitha?
With the pacemaker, if the battery does run low or something, do they have to do surgery again and like replace it?
Yeah. So, I mean, but basically this one though, they don't have to do the whole like intensive surgery where they have to go in and connect it to the heart and everything. They basically would make an incision to either replace the battery or replace the main component, and then just attach it back in. So I believe it is an outpatient surgery. They'll just do a local anesthetic around that area, make an incision so that way they can pull it out, and then they just kind of slide it right back in.
So how long does it last?
I mean, some people have it last for like 5 to 10 years. But each device is kind of, they usually have them check it like every 6 months just to make sure that it is working, because sometimes you can have really minor symptoms with if you have like atrial fibrillation or other irregularities. So yeah, that's why they have them check, make sure that the machine's working properly.
Okay.
But yeah, somehow for some reason people can some of them last for a really long time. So, but I think on average what they say is the battery's supposed to last for at least 5 years.
It's a long time.
I know, yeah. And it's a really tiny battery too, so.
Yeah.
Okay. So you ready to play some Jeopardy?
Sure.
Okay, so I didn't really, because this is all cardiac related, so I didn't know what to like label these up here. So I just labeled them as different sections. So you get to pick where you want to start.
Okay. I'm probably not gonna know any of them though, so don't be disappointed.
That's okay.
I'll do section 4 for 2.
Okay. Yeah, what does cyanosis mean?
Caitlin,
Can you hear me?
can you hear me?
I can hear you. Can you hear me?
Okay, you're kind of cutting out.
Oh, I might not have been close enough. But what does cyanosis mean? Like if you went up to a patient and they said, the patient is cyanotic, what do you remember what that one means?
Does it has something to do with blue?
Yes.
So
it's a bluish color of the skin because they're not, there's a lack of oxygen in their blood.
Yes. Very good.
Okay, perfect.
Okay.
All right, which one do you want to go for next?
Section 5 for 100.
All right, so what are erythrocytes? What do they do? I'll give you a hint. It has to do with different blood cells. But you have erythrocytes, leukocytes.
So like blood cells.
Yes, but what type of blood cell is the erythrocyte? Is it a red blood cell or a white blood cell?
It's a white blood cell. Okay.
No, it's actually a red blood cell.
Oh, that's what I said. I thought you said it's a white blood cell. You're kind of stuck cutting out a little bit, but it's all good.
Sorry. So yeah,
I think it might
leukocytes
be
are the
my
white blood
favorite.
cell. Erythrocytes are the red blood cell.
Okay.
Okay. Which one do you want to go for next?
Section 3 for 300.
So plasma is that part of the blood, but what is plasma made out of?
Is it
majority of the plasma made out of?
Water?
Yeah.
Yay.
Yeah.
I'm right here.
All right.
Okay. Section 2 for 400.
Okay. Yeah. So what does it mean if a patient is bradycardic or bradycardia?
It has something to do with the heart. Hold on, let me remember what.
Yes.
I'm not quite remembering what Brady means.
Do you want me to tell you?
No.
Okay.
Like a slow heartbeat?
Yes.
Slow? That's okay. Is that what Brady means? Brady?
Mm-hmm.
Okay.
At what number would they be considered bradycardic? Their pulse rate.
Like 70, 60, 50, 60.
So it would be below 60. So anything below 60 beats per minute is considered bradycardic, so that they have a slow heart rate, which isn't always bad. So some people, especially like athletes, have a slower heart rate, and it's not necessarily a bad thing. So, okay. Which one do you want to go for now?
Section 1 for 500.
Which section?
Section 1 for 500.
Okay. Yes, what is the difference between arteries and arterioles? So what is an artery? Let's start there.
I'm so sorry, Kayla. It's kind of lagging a little bit.
Oh, gotcha. I'm sorry. Is it a little bit better now? Oh, I think I lost her. Shoot.
Yeah, it's been fine on my end, so it's probably her connection.
Okay, gotcha. Sometimes my WebEx freezes and does really weird things, so
Yeah.
But yeah, hopefully she'll just join right back in. Sometimes that's what I have to do is come out and go right back in.
Yep. It's a cool bingo program. I hadn't ever seen that before.
Yeah, it's oh, there she goes. It's on jeopardylabs.com where you can just go in and create one. It's really easy and you don't have to like have an account or anything, and it just pops up. So
Oh, sweet.
it's funny. Last week when I had a study session where we played Jeopardy, I had like 5 students, and it was a very intense competition. So especially at the end, because the last question I always have it as like a free for all, regardless of whose turn it is. So whoever answers first gets the points, and yeah.
Sounds fun.
That came to that was it was really funny actually because they were talking over each other and arguing with each other, and yeah, it was funny. Tahila, can you hear me better now?
Yeah, so sorry.
Okay, good. No, you're fine. So what I was saying was, why don't we first talk about what an artery is, and then we can talk about the difference between the two.
Okay. So I know like arterials are smaller.
Arterioles?
Right, yeah.
Mm-hmm.
I think. Okay, cool.
Yes.
And blood travels through the arteries, the heart, and the body.
Pretty much, yeah. So the arteries, yeah, carry the blood away from the heart, but also bring blood back into the heart. But the arterioles are the smaller than arteries that will move blood into the capillaries. So, okay. Which one you want to go for next?
I'll do section 1 for 100.
Okay. Yeah. So what is the purpose of the cardiovascular system? What does it do for our body?
Blood through the body.
Yes. And what does blood do for our body? What is it delivering?
Like nutrients and vitamins.
And oxygen as well.
And oxygen.
Yes.
Of course.
And it's also carrying away waste products from other cells to be excreted. All right. Which one do you want to go for next?
Section 2 for 200.
Is that section 2?
Yeah.
Okay. Yeah. What are the 3 layers of the heart?
That is an excellent question.
I'll give you one, and then we'll go from there. But you have the myocardium.
Okay.
That's 2 more.
Epicardium and endocardium.
Yes.
Oh.
Yes. Those are the 3 layers of the heart.
Cool. Very good.
Okay.
Okay. I'll do section 4 for 300.
Oh, yeah. So what are at least 3 symptoms of an MI? So do you remember what an MI stands for?
Myocardial infarction.
Which is a fancy way of saying what?
Heart attack.
Yes. So what are some symptoms of a heart attack?
Like shallow breathing. And the like chest pain.
Mm-hmm. What's the fancy medical term for chest pain?
And angina.
Yes.
Okay. Um, lightheadedness, fainting. Was that 3?
That is, but the main symptoms a patient would have would be shortness of breath, angina, chest pressure or tightness. Usually that combination of shortness of breath and chest pressure or tightness, that's kind of like, that definitely sounds heart related. Pain in like their left shoulder or arm, and sometimes it could be just like back pain as well. So like if a patient has a kind of a combination of like shortness of breath and left shoulder pain, that's definitely a symptom of a heart attack. But they'll also have like the shortness of breath and like that chest, anything like feels like there's a weight on their chest. That is one of the most biggest indicators of a potential heart attack. Sometimes people may not even be short of breath. They may not have chest pain or shoulder pain, but they just feel this intense pressure. So yeah, usually pressure is one of the biggest signs potentially of someone having a heart attack. So yeah, so if you have a patient that comes in complaining of chest pain or pressure, main questions you want to ask is if they are having any shortness of breath, chest pain, pain in their left shoulder, or any back pain.
Okay.
Good. Okay.
Section 4 for 400.
All right. So this is the opposite of the bradycardic. So what does it mean if a patient has tachycardic?
Like fast heartbeats.
And when is it considered? How many beats per minute is considered tachycardic?
I think it was like more than 100 beats per minute.
Yes. Anything more than 100. All right. Perfect.
Cool.
Good job.
Section 5 for 500.
This one I kind of briefly went over.
It started. I know you said any medicine that ended with like something that started with an S.
Statin.
Statin.
Yeah. So this one's kind of. I didn't really go into like the in-depth and detail about the different types, but the most common ones, and I put in the brackets here the brand name, which, by the way, the brand name medications will always start with a capital letter, but generic medications you do not capitalize.
Okay.
So this is the generic name for it: simvastatin, atorvastatin, pravastatin, rosuvastatin, lovastatin. There's a lot of statins. There's way more than this too. These are the most common ones though that you'll see. But yeah, the brand name for simvastatin is Zocor. And I think that's one of my biggest things is there's a medication called Cozar. And I get confused between Zocor and Cozar because they sound so similar. So, yeah.
How do you like memorize all of them? That's a lot of medications.
Once you start seeing them pretty frequently, you'll start to like remember them more often. So,
Okay.
But yeah, that did take time to learn because yeah, it was pretty much when a patient would say like, "Oh, I'm on Zocor," but their medication chart would show simvastatin. I'm like, I don't see that on here. And then, and luckily too, a lot of electronic health records, if you type in the generic or the brand name, it'll usually pop up with the alternative as well. So, which is really nice. But it'll take time.
Okay.
To memorize the difference between the brand and the generic. So, And almost always the generic name is going to be much longer than the brand name.
Mm-hmm. Okay. I'll do section 3 for 400.
Okay. This is the test that
Oh
uses.
my god. Oh my goodness. I'm so sorry. I know we just went over this.
That's okay. I'm going to post a link to the Jeopardy game too to study that as well.
That'd be cool. Yeah. I can't remember.
It's an echocardiogram.
I knew that. I
Or
did.
oftentimes we just call it an echo.
An
echo. But yeah, basically an ultrasound of the heart.
And does it create like an actual picture or just?
Mm-hmm.
Wow.
And it's really cool because they can actually, the technician can show, or like it can change the color of the different ventricles. So then it can kind of show them, like, from the right atrium to the right ventricle, how it's flowing in there and then into the other sides and everything. That's really cool.
Yeah. Let's see. I'll do section 3 for 200. Oh,
Yeah.
it was like O positive.
Yes. Well, O negative is the universal donor, but type O blood in general is the one that can give blood to any other type of blood, but they can only receive type O blood. So.
Section 5 for 200.
Which section?
5.
5? Okay. Yeah, so this is the term for when you have a fast heartbeat, fluttering, and that pounding feeling.
Is that tachycardia?
Nope.
Arrhythmia?
Mm-mm.
Just kidding.
Arrhythmia is the one that is something that is long term, and this is one that is usually acute, meaning it's like a sudden onset and does not last a long time. It starts with a P.
A P?
Mm-hmm.
Petrocardia? That's not a thing. I'm psychic. Pericardia?
No.
Pounding heart? I don't know. I'm guessing.
Palpitations.
Oh my god. I thought it was like, I knew that. I did. I swear to God.
That's okay. Alright, which one you want to look at next?
Section 5 for 400. Chest pain.
Yes.
Section 1 for 300. Okay, wait. The right side?
Yes.
I had to turn around because the diagrams are always flipped. I'll let you choose.
Okay. So we talked about what plasma is made out of, but what percentage of blood is the plasma?
I think it was 55%.
Yes. Okay. You want me to just choose?
Yeah.
Okay. So who is, what blood type is known as the universal receiver?
Oh, was it AB?
Yes. It's specifically AB positive, because It's I'll have to link a video that explains the blood types a lot better because you have, the different blood types, but then along with it, there's the positive or negative.
Right.
Type positive blood can receive negative or positive, but negative blood can only receive negative blood.
Okay. What does
And there's a video that explains it a lot better than what I can, so. Okay. What does DVT stand for?
oh boy.
And you can even say the non-fancy medical term for it too.
Varicose veins?
Nope.
No, just kidding. I
The V
read,
is for vein.
was it like the clotting thing and the leg?
Mm-hmm.
Um, deep
Mm-hmm.
vein thrombosis.
Yes.
Yeah.
Deep vein thrombosis. Yes. Because if you think of thrombus as the clotting factor,
Yeah.
and because it's a vein that's like going to be really deep internally, so it's a blood clot really deep in the vein. So, okay. How many chambers does the heart have?
4.
Yes. And what does it mean if a patient is anemic?
They don't have enough red blood cells.
Yes, they're not producing enough. Okay.
They don't have like the clotting factor that stops them from bleeding.
Yes. Okay. Ooh.
Oh no.
This is a hard one.
Oh what? Cardiac cell. I'm gonna be honest. I do not remember.
That's okay. So there's the electrical and myocardial cells.
Okay. Electrical myocardial.
That one, yeah, is a hard one. What? So, what does blood pressure measure?
Is it like how quickly the blood is going through the veins, or like how hard the veins are pumped? You know, like how.
Yeah, it's the amount of pressure being put on the veins. So during contraction where it's forcing the blood against the walls, that is the highest, the systolic or the higher number. And then the diastolic is when the heart then relaxes. So the lowest amount of pressure on the veins. All right. This is another hard one. So the valves separate the atrium from um, the ventricles. So
that like the blood doesn't go into the wrong part.
yes, and also prevent backflow.
Yeah.
So basically, the AV valve prevents the backflow of blood into the atrium once that valve is closed, and the SL or semilinear valve allows blood to flow out of the heart, but then prevents backflow of blood into the ventricles.
So they're just like the little flaps between the different. Okay.
Yeah, they're those little things that like separate the different ventricles of the heart that open up to pour blood in and then close because then when it contracts, it needs to go to this like other area. So they want to make sure it's closed so it doesn't go back into where it just came from. All right, and then last one. So what does it mean if a patient has endocarditis?
Does it have something to do with inflammation of or infection?
Infection, yeah. It's a type of infection in the endocardium, which is the inner lining of your heart chamber.
Mhm.
So it's an infection in there, which is not good if someone has that. So, and just because I want to show you a thing real quick of the echocardiogram, because it is really cool. I'm gonna have to like a. So let me see if I can find one that has color to it. But this is an image of an echocardiogram, so it's showing the different ventricles, and then you can see the valves closing and opening. But they're, when they do it where it has the color in it, here we go. So this is showing the deoxygenated blood and then the oxygenated blood, how it's flowing through.
Mm. Oh, that's
So
cool. How do they make it like colored like that?
I have no idea, to be honest with you. But it's cool to see. It's just I've never done an ultrasound, but it's some setting that they can do where I'm guessing that they have some setting where they say everything on this, these sides should be blue and then on this side should be red.
Mm.
So, but yeah, and this is a picture too of like the different valves in your heart as well.
So is that how they do like the baby scans or whatever they call?
Yeah, the ultrasounds.
Yeah. Sorry.
No, you're good. But yeah, those are the valves opening and closing. So it looks much different on an ultrasound than you would think that it looks. So,
yeah.
But I think this is nope, not that one. Ooh, I don't know what that person has going on there. But yeah, so anyhow, yeah, do you have any questions?
I don't think so.
All right, cool. Well, thanks for joining in, and I will make sure I'll post the link to that game as well, so you can go and study it there too. So,
thank you, Caitlin.
You're welcome. Have a good rest of your day.
You too. Bye.
Bye.
Thanks, Caitlin. Appreciate it.
No problem. Have a good rest of your day too.